All right, we are live. Welcome. Welcome to our Wellness Wednesdays with Nurse Connie, and I am Nurse Connie. And today we have a special guest, Mr. Jonathan Williams, MPA BSN RN, majoring in psychiatry and behavioral health. He is on track and a rising MP student with his focus in psych mental health nursing with a strong focus on the LGBTQIA population and their care. And today we're going to talk about PrEP and how PrEP is affecting our community, pros and cons of PrEP. We're going to give some statistics and we're going to hand it over. So, Mr. Jonathan, Nurse Jonathan, can you tell us what PrEP is?
Such a thing on being understood.
Having technical difficulties.
Now I can't hear anything. This is great. I'm so sorry, guys. I'm still
Can you
having
hear
these
me?
technical difficulties. I cannot hear any audio for some reason right now. This is awful.
So go ahead. I can hear you fine.
Jonathan, can you hear me?
So-
Jonathan, can you hear me?
Can you please try this? I'm
Okay,
sorry,
so your
guys. My
viewing
audio
audience,
is out and I can't hear you guys anymore. I don't know what happened.
there seems to be some technical
This is
difficulty.
awful.
I
One
would tell
second. I'm just going
Jonathan
to
to
try
go out
to
and to come back
log out
in.
and come back in again.
Maybe I can
Log
Just gonna
out,
leave
come
and
back.
back.
go out and come back in and try it again. Okay, here you go. And Nurse Connie, what are we talking about today? What's happening today?
We're going to be talking about PrEP and HIV statistics and how
So
HIV
HIV is still a big thing?
absolutely and
Hmm.
sadly,
Hmm.
it's affecting the a much younger age group today. It is affecting 13-year-olds to 24-year-olds. They are the highest
Wow.
demographic.
I know that you don't know, but my brother passed away from AIDS. And this
Wow.
was back in the 90s. This was back in the 90s. He
Yeah.
hadn't made 40 years old just yet. He was still in his 30s. But yeah, I thought they had protection for that already. I thought you could take a
They
pill
have
now.
preventative medicine that's out, but right now I think a lot of it is behavior modifications that need to be in place.
As well.
And
Yes.
basically, people aren't taking the right precautions. So we need to shed some light on prevention and health promotion and the best way to keep themselves safe because people
So
still
let me
have
ask you, Connie,
unprotected sex.
what would be the suggested things that a person should do so they can avoid the HIV? I mean, other than wearing a condom, what else is there that you can do?
It's plenty. I'm going to hand that over to Jonathan. Are you checked back in?
I'm checked back in. I can hear
All right,
everyone right now, guys. I can
good.
hear you, Kendall. I can hear you, Connie. I'm on board and I'm
All right.
All
ready to
right,
go,
this is
guys.
this is let me just tell you, Jonathan. This
Yes,
is
sir.
Nurse Connie's show, and I know
Yes.
we had a couple of hiccups coming into the show, but this is this young lady's show. So I was only asking the questions to get the wheels turning.
Yes.
That's all.
all,
But I'm
all,
out of
all,
here.
all good. All
Thank
good.
All
you,
right, I'm
Kendall.
out of here. Peace.
Hello, Nurse Connie. So, guys, thank you for having me. Again, my name is Jonathan, and I'm just going to bring some light into this topic that we're on here about HIV prevention, because we have the tools now in our hands to protect against new infections. There's PrEP. PrEP is there's two forms of PrEP. One is called Apretude, which is every 2 month injection, and the other could be a daily pill, Truvada or Descovy. Both of these medications are available either through your through your doctor, or if there is a community um, a community resource center that provides sexually transmitted disease testing and HIV testing, and usually they'll also provide you with resources to go. Here in New Jersey, where I'm at in Newark, We have a few places, a few hospitals that offer these services, and it's easily accessible as well as testing. So, alongside with also behavior modification, like you said, Connie, using protection as well. Um, PrEP, and I'll just pull up my statistics here with PrEP and just give you a little background on what PrEP is. Okay,
Can
so
you tell us
PrEP.
what the acronym PrEP stands for?
So PrEP stands for pre-exposure prophylaxis. So
Okay.
pre-exposure prophylaxis. Um, and with this medication, these medications are not meant to treat somebody who already has HIV, but rather prevent someone from getting it. So it started off back with Truvada and Truvada. That was the first line of PrEP before they came up with the injection. Some people find it easier to take an injection every 2 months versus taking a pill every day, which I can understand that. But the efficacy is the same across the board. According to the aptitudedrugs.com, it's 99% effective from preventing HIV infections. Let me just break that down. Aptitude is a long-acting injectable pre-exposure prophylaxis medication used to reduce the risk of HIV-1 infections in adults and adolescents. So it's administered as an injection, and it also can be taken as pills, like I said, but that would be with the Truvada. Okay. Um, the important thing to note is that you have to be tested negative before taking the PrEP, before getting starting on PrEP, because if you're not negative, like say you're positive and you don't know it and you take PrEP, it can make the HIV harder to treat or resistant. So it's important. That's why prior to taking your injection every 2 months, you're going to have your testing to make sure you're still negative. Also, you're using your other prophylaxis like condoms, things like that to prevent HIV. Um, as I said, clinical trials have reported, and we have a lot of clinical trials that have reported 99% effective at preventing the HIV-1 transmission. And what it does is, I'll just talk a little medication. I'll go into a little pharmacy.
Keep
It
it
works.
simple because the community, you got to keep it very
Absolutely. So what it
simple.
does is it works by what PrEP does is it prevents HIV from entering and inserting its DNA as a virus into the cell and replicating.
Right,
So there's nowhere for it to reproduce. So it will just eventually leave or die off. It won't.
right.
It won't be able to reproduce in the system, and that's how you end up with an infection. And so
Now,
this is what.
HIV, I'm going to interrupt you real quick.
Mhm.
HIV, just for the newer generations and this uh, younger population, HIV is human immunodeficiency virus, which basically has been around for decades, but there was a big boom in the 80s and the 90s. And prior to all the antivirals that we have now, prior to PrEP, this virus had killed millions. And it's still, sadly, in sub-Saharan Africa, it's still a pandemic there because they can't get the drugs and the medicines that we have in the Western world here in the United States and Europe. So
And
for
if
the
I may interject, just a quick
yes,
sidebar, it's good to know that in sub-Saharan Africa, prior,
yes,
and I don't mean to go political, but prior to the administration that we have now,
yes.
these medications were being readily made available
Mhm.
through the USAID. And so with the ending of that, we saw all of those HIV medications literally being thrown in the trash instead of given to the
Wow,
people. That's
wow.
just a quick sidebar. Um, but to
Okay.
go to delve back into just give
We
me
were
one
you
second.
were giving us information about the injections.
Yes.
Right.
Okay. I'm sorry. I just gotta get back into my so as far as the injection, it's every 2 months. And as I
Okay.
said, it's available to anyone who basically is not already infected with HIV and who has access to it, and it's readily accessible. So to circle back or segue to where we were talking about as far as infections in the United States. So according to the CDC, and it's on their website. I'll just give you a quick blip. Starting from 2024 to 2025 December, this was the statistics in the United States. Among persons greater than 13 years, over 38,000 people received an HIV diagnosis between 2024 and December 2025.
Slow
Men are
down.
most, I'm
Woo!
sorry,
That's heavy. I don't want you to
very,
breeze past that. The age group 13 to 24 has the highest demographic. Do you hear that? And then what ethnicity is that?
so let me segue down there. I will tell you.
Because I don't want to just breeze past
Oh,
that statistic because that's very important.
so
The
among
babies.
among so
Go ahead.
among so we're going to go to demographics. Among males aged 13 to 24 who identified as men who have sex with men or
Right.
in the LGBT community, Black American or African American males accounted for the highest percentage of those, 47% of those diagnoses.
47.
And
Wow.
and males residing in the South accounted for 50% of all of those diagnoses altogether.
Wow.
So it leads to a question of where are we missing the ball? Where are we not getting that? Where's the information? Where's the
Why?
act? Why is it so heavily affected in that region? Why is it so heavily affecting the African American community, especially African American men? Um, of course, you have to take into consideration
After
socio.
all the antivirals and all the all the uh, progress that they have made with HIV, why
Mhm.
is that statistic still so high? And why is it still, that's like pandemic numbers in our
Especially
community?
for the young generation.
You're talking
It's the
puberty, 13
We're
to 14
talking
years old.
13 to 24 years old. That's exactly adolescence into
Adolescent.
early adulthood. And so um, I can speak on my behalf in growing up here in New Jersey. And we had a lot of visibility. There was a lot of education
Mhm.
given and a lot of resources. Here in the city of Newark, we have a lot of resource centers where you can go and get those tests that you need. You can get pointed in the direction to get condoms and protection and also get that medication prep that if you're in a position or if you're in a part of a community that is considered high risk and you are, say you identify as a male who has sex with male or even if you identify as not, because it's not only for LGBT people.
Absolutely not. And we need
Right.
to make that clear. This PrEP
It's
is not for the LGBTQIA
it's
plus.
for all
It's
women,
for
men,
anyone.
everyone.
Anyone
Um,
having unprotected sex, basically, male or female, heterosexual or not.
Absolutely. And another segue, just to add, it's important to note that even though you're on PrEP, it does not prevent other STDs as well. It's
Right.
only for HIV infections. Right. But to have the medications that we have, to have made the science, the progress that we have in science coming from, like you said, back in the 80s, or Kendall said back in the 80s, to where we are now, and to have those numbers, especially, we're not talking injectable drug users. Those statistics are there on the CDC website as well. I'm focusing more on the sexual contact aspect there. The because the injectable drug users do contribute to a portion of those statistics as well, and that 38,000 in infections. But my focus really, especially in my focus with my practice, is with LGBT youth of color. And
Right.
and in the inner city, socioeconomically disadvantaged, and it's alarming to me that in the South, and I don't have much knowledge of the South. I don't have much time. Haven't spent much time in the South. I'm not sure what resources are available. I know it's a lot different geographically from here in the Northeast. I mean, even where you're at in Pennsylvania, Connie, it's a bit different. There's a lot more of a travel distance. I don't know. It also depends on what
I
kind of
feel like locally, the resources aren't here as well. They do have prep and like community health centers, but not like an urban or metropolitan city. Those
Absolutely.
is the
And
funding is not here. Do you
right.
find that it is more prevalent because and people are more high risk right now because they use prep as sort of a crutch, so they
I
tend not to use condoms or other prophylactic protection. Do they?
absolutely. And that brings me to another point. Go ahead, Connie, finish your thought. I'm sorry.
So you know I want you to expand on that, because that's the feeling I get. Like, there's hundreds of antivirals out,
Hmm.
have made scientific leaps and bounds with HIV. At one point, it was on the top 10 uh,
Hmm.
causes of death, and it no longer is on the top 10.
Hmm.
However, the statistics are still so high, especially in the African American community, as well as LGBTQIA plus community, and
Hmm.
I would say the Hispanic community as well.
Absolutely.
Do you
Yes.
think it's because lack of access, lack of education, or simply poor behavior practice, and saying, oh, well, I'm not going to get AIDS if I take PrEP. So they're just kind of loosey goosey and being irresponsible? Or
I
is it
think it's a multifaceted approach with this because I think there is an element of invincibility because, oh, I'm taking this prep, it's clinically trialed, 99% effective. I don't need to use that condom. But there is that 1% chance that you can get it because it's 99%. It's not 100%. There's no 100%. There's no cure. There's no 100% protection from there. Also, I will go back and circle back to what you were talking about as far as the advances that we've made with the antiviral treatments. Now, with the antiviral treatments, you have what's become the phenomenon of undetectable status, and
Mhm.
this is very prevalent, and you'll see this a lot on the dating apps. Oh, I'm positive but undetectable, and in my experience and my talking with my people in the community, people have had this notion that, oh, I'm undetectable, so since I'm undetectable, I cannot pass HIV through intercourse. So therefore, I don't have to tell this person that I have it, so now that person might be blinded. And then also, as the person who's going into the situation having an encounter with someone who might be positive and undetectable, who
Mhm.
knows? Who knows their status? Are these people getting tested? How do they know that they are still undetectable? How do that's all based on the frequency of your testing, the frequency if you're complying with your medication regimen. So I think that does play into it. I do think there's an element
You're
of, yeah, there's
breaking
a
up,
loose.
Jonathan. You're breaking up. You sound very like muffled. I don't know why, but
Yeah, I don't know what happened. Can you hear me? How's
yes,
that?
I can hear you. Okay, go ahead. Continue.
It just started getting really choppy. Can you hear me now? All good?
Yes, but choppy.
Yeah, mine is choppy too. I don't know what's going on here.
Almost like a poor signal. Uh,
Yeah,
have you work on that. However, just to continue, yes, HIV is still prevalent in the Black community specifically, and our younger youth are definitely being affected. And it's just unfortunate now. At one point, the age group used to be 18 to 24, which was being affected, and 24 to the 40-year-old age group. And then at one point, it was the seniors, like 65 plus. But now the new statistics based on the CDC from 2024 to 2025, we have adolescents ages 13 to 24 and young adults being affected, which is like mind blowing. And definitely at home, there should be a lot more education that's being taught to these young folks about sex and intercourse and health and their hygiene. And you're muted, Jonathan. I can't hear you now. You're on mute. It's you might have to sign out and come all the way back in. Yes. So right now, we're just going to ask you to please subscribe. If you leave a comment, ask a question. This is the PA Empowerment Network. We could be reached at 570-664-0574. And the opinions of the host and the guests and their guests may not be the opinion of the network. Just be mindful of that. But we're here to teach. We're here to learn, educate our community, and PrEP definitely, Nurse Jonathan, as he related to everyone that he actually takes PrEP, so he has a lot of experience with this particular prophylactic drug. And
he got his mic on mute. He got his mic on mute.
Okay. And it seems you're still on mute, Nurse Jonathan. You're on mute. Okay. Are you still choppy? Yes. It's a bad signal. So PrEP and HIV is still prevalent in the community, and we need to educate more young folks, especially minorities who are suffering at higher rates than their counterparts.
Connie, I'm telling you, I wish they had that available when my brother had AIDS. You know, how long has this treatment been around?
PrEP has been around, I would say, for at least 10 years. And at first, when they first rolled it out, it was for high-risk populations, LGBTQIA plus communities and groups. And then it kind of rolled out more to the heterosexual community. But I find that, I'm just curious that if the rates are still so high with all the advancements that have taken place since the 80s, it has to be, behavior has to play a greater role in this. Because you're not going to die from it. Back 20, 30, 40 years ago, people were dying because there were no drugs. There was no medication. The antivirals were not available to everyone else. Going to the days of where, say, like Magic Johnson, when he was diagnosed.
Yeah, that was funny. Magic, I don't mean to cut you off, but it seemed like Magic Johnson, what the hell did he take? Because he still seemed to be rolling along nicely.
That's the thing. The antivirals were available back then, but there was a cost, and people with money could afford it. So, of course, he was a millionaire. He had a lot of access to medications that the average person didn't have access to. So, yeah, he was on antivirals before antivirals were like a big thing.
So what is this I used to hear? They used to say that they used to say he went to Africa and that they had some sort of cure or something in Africa or within the African countries. You ever heard that?
I know I haven't.
I've never heard of that either myself.
No,
yeah, this is about Magic Johnson. I'm a lot older than you guys. So back in the day when Magic Johnson was when he contracted the AIDS and the AIDS was a big thing, HIV was a big thing. They said that it was a rumor that he had went to Africa because nobody could believe that this man could live so long and live so spry and had AIDS. Everybody else around you that was contracted the HIV and then eventually turned into the AIDS. Everybody you knew around you was dying.
He had
No,
access to those
it's like if you
drugs.
had
It was
AIDS back
viral.
then, if you got AIDS, it was a death sentence.
Yes, it was a death
And it's important
sentence.
to note, just if I can interject really quick. Sorry, I'm back now. My audio's better. If it's important, I just want to add to, even like we've had with the antivirals, you might have been on a cocktail of pills when Magic Johnson and his era when he first became infected.
Absolutely. It was
Now there's one
multiple.
pill that's combining. Right. Now it's just one pill you take daily, and they're so effective that they can reduce the viral load, which is the amount of the virus in your system, to a point where it's undetectable. And according to studies, when you're at that point where you're undetectable, you can no longer transmit it to anyone else through
Mm.
intercourse.
And
So
is that
I
what the
think
research is finding? That's true.
that's what the research has
Wow.
confirmed that
I wonder how these researchers find this out. What do? They go check everybody that they sleep with or something?
so what happens is there's a lot of regular testing going on. So if you're in a treatment, if you're an HIV positive person, or you're going to get tested, even if you're not, I can speak on my behalf. I take PrEP. I take PrEP. It's every 2 months. I get, they do an HIV test on me, and then after that, you get your injection and you're good to go. So you would know if you contracted it from some way or another. As far as the viral loads in the system, there's blood work that can be done. They'd have to do draw the blood samples every so often, and they'll have with their primary care provider, and then they would be able to confirm that their levels are below that threshold that counts it as undetectable in the system.
Mhm.
Is
Now,
there a
I think it's
now
important to note that. I'm sorry.
with all the federal cuts? How are folks acquiring it now? Or is it free? Is there funding? Is what's the cost for it now?
Uh,
Financial, finance wise.
so I was hearing you, and then your volume went out again.
Oh, sorry. I
Anyway,
was
but I
saying, is
did
there
remember what you were saying, so I can answer the question. I can't hear you right now anymore, but I'll answer the question.
okay.
So with the cuts to DA Department of Health and Human Services, with the cuts that this current administration has implemented, a lot of those programs like HIV protection, or HIV prevention, access to those things have been cut as well. And that has dramatic. I think that just to see that number, I mean, if you look at where a lot of the cuts are happening and where those cuts would be most really making the greatest impact, inner cities, socioeconomically disadvantaged areas, people that don't have access to, healthcare, health insurance, or primary care physician, and also people that just don't have that access. I think that those are the places where those cuts were. Those are the populations that are being affected, and unfortunately, we tend to see a disproportionate amount of, African American and Hispanic individuals, especially LGBT individuals of youth 13 to 24, in a situation where they might not be socioeconomically advantaged enough to have a primary care physician, or might are able to have, get routine care, less likely to go and get regular checkups or to go and get regular testing, and especially in areas like the South, because there's just a lack of access to it. And then if you look at the administrations that are in the South, the governmental structure in line with our federal structure, it all kind of goes hand in hand.
So sadly, then going forward, unless things change, there's going to be an increase, an even higher rate of infection rates, simply because those
Connie, I'm going to
resources.
go out and come back in because I cannot hear anything you're saying again.
Okay. So, based
It's
off of
crazy.
what Nurse Jonathan said, um, for those communities that are affected by the cuts, the inner cities, the minorities, LGBTQ communities, there's going to be a higher rate of infection without access to those resources and funding uh, to help with those PrEP kits and education and follow up. So behind the scenes, as you know, life is going on. There's a whole underlining rise in infection rates that will be taking place in communities. And once again, it is not just LGBTQIA plus communities. The
I'm sorry,
heterosexual
I can't
community,
hear anything you're
male
saying.
and female, that are not having protected sex are at risk for increased rates of HIV. So we have to educate our children. We have to, have more workshops, programming, seminars, information about protecting yourself, getting checked, knowing your status is still very important. I mean, here we are 30, 40 years since the AIDS epidemic. And technically, the Black community, we're still in an epidemic from HIV with all these advances. So it's a lot of work still left to do. We still have a lot to be done as far as protecting ourselves, having healthy relationship behaviors and intercourse interactions. People have to either abstain, they need to know their status, they need to use protection, um, they have to be healthy, take care of themselves because
Connie, I honestly,
yes,
I don't think people in today's time, especially the youth, I don't think they really understand the dangers of AIDS.
they
I
do
just like to
not.
tell people, my brother passed away from AIDS. I said that in the beginning of the show.
Hmm.
And not only did he pass away, he died in my arms. He was in hospice. And
Wow.
it's not only a tragedy for the person that has the AIDS, it's also a tragedy for the people that are around him, his family,
Families, yes.
friends. My brother was a hell of a person. To me, he was great. So with that, I'm gonna let you go ahead and finish up your show. Sorry about that, Connie.
Yeah.
I just wanted to introduce that. I just wanted to find out how ready steady can these people still receive medication? Is that still a difficult thing for them?
um well, from let's go back, maybe say 5 years. The access is
Audio
there,
keep cutting
the
out.
medications are there, PrEP is there, the antivirals are there. There's so much
It's crazy.
access
It's like the
to it.
audio cuts out.
However, the there's been major cuts. There's major cuts, and the community and the demographics that are going to be affected by that are minorities because we are still the highest demographic, African Americans, 47% ages 13 to 24, as well as Hispanics and communities in the South. Uh, and that was my question, was with all these cuts, there's going to be a greater increase. There's going to be another rising of statistics uh, without people being able to either change their behaviors, abstain, use protection, or having access to these antivirals. But there are so many cuts to the human health services and local, say, Planned Parenthoods and community health clinics that they're not getting the funding to provide these resources and these drugs for the communities. And
Yeah,
as you
that's
can
one of the
see,
things I wanted to ask you, Connie. So we live in Monroe County in Pennsylvania. We have approximately 30,000 African Americans that live here, which is about 17%. What percentage of that would you say actually has the AIDS virus?
I have no idea. I would have to check the website for the um, health department for Monroe County. I could give those
Hmm.
statistics later. I can definitely get them, but I don't know that number specifically off the top of my head for Monroe County. Um, the
How often?
CDC's the CDC's numbers are based on the United States. That's the
Mm.
whole country. So which still
I was,
it's a
you know,
high.
look, we live here in Monroe County. We live out here in Pennsylvania. So I just
Mhm.
wanted to see where we stood, how we stand. You know, I mean, we're talking about AIDS, but how many people have you actually examined that you come to find out actually have AIDS?
I've had plenty of patients that are still HIV positive. Believe it or not, uh, once again, like I said, it's not in the top 10 of causes of death because we have the medications to suppress the virus, and this virus is being undetected. But people are still HIV positive. People are still HIV
Yeah,
positive.
I'm here with you guys. I'm back. My audio. I'm sorry. Apologize for all the technical difficulties I've been having with my phone here. Um, uh, Connie, can you just say something so I can make sure I can
Yes,
still hear you?
yes. Welcome back.
Yeah, I don't know what happens when Kendall goes out. It's like your volume goes away. I can't hear anything you're saying anymore. When he's here, I can
Okay.
hear you guys. I'm just having the worst time with this technology today, guys. So really apologize. Thank you.
Um, no, we were just discussing that the prevalence
Happens.
is still so high in the African
I'm
American
sorry.
community. Are you there, Nurse Jonathan? No, you're not. Yeah.
All right,
But
Connie.
I won't
Let's
prolong
roll.
it. I won't prolong it
Yeah,
any longer.
let's roll with
We're
it.
gonna
Let's roll
thank
with it.
Nurse
I want
Jonathan.
to thank Nurse Johnson for coming in, and you know, on this
Yes,
show we have to thank people properly. We just can't say thank you. So,
yes.
Jonathan, here you go. Thank you very much for coming in. We truly appreciate this to make you understand that. Is he here in Pennsylvania?
No,
No, where's he at?
New Jersey.
Oh, New Jersey. So, is there a big epidemic there with the AIDS virus? Is it growing there? What do you think, Nurse Connie?
A- Absolutely. I feel like, especially in like metropolitan or urban areas, the statistics are still high. The statistics are high in African Americans. It's not killing, or people are not dying from it like they were in the 80s, but they're still testing positive. They're still
So,
HIV positive and infected, sadly.
all right. You know what I'd like you to do? I would like you to go over it again, ways that we can protect ourselves from the AIDS virus. Can you hear me?
Yes. Again, safe sex, of course, abstinence, which is not having sex. Some people are, promote that. So abstinence, safe sex, using prophylactics like condoms, getting tested uh, with your partner or a potential, potential sex partner, knowing your numbers, and being a safe person in the community. Another reason for these high rates and the spread of this infection, which I won't, that's a whole nother topic we could touch on, is in within that LGBTQIA plus community, there is a significant amount of heterosexual men that are on the DL that have sex with men but don't consider themselves gay, that are transmitting diseases as well. And they're like a danger to the Black community, because if you're not going to be a safe gay person and be out and proud, but you're living as a heterosexual man that behind closed doors, and you're in the closet, so to speak, and you're having these dangerous relationships and promiscuous relationships, and you're bringing that lifestyle that you have underground back home to your family, that's a danger and that's a threat to our community. So
Just to
that's a
reiterate,
whole nother
right?
conversation.
But just to reiterate, it doesn't matter
But
who you are.
it doesn't matter who you are,
Anybody can get
male,
AIDS. AIDS,
female,
males, females, doesn't matter
young,
your color,
old.
your race. doesn't matter anything like that. So
You
let me
have
ask you.
to be safe.
I don't want to have a young lady thinking that she's taking birth control and thinking that's a way of preventing AIDS.
No, because birth control is for procreation, preventing procreation. So that would have nothing to do with controlling a virus or a disease. And I want to make clear again, PrEP is only for HIV. So it's not going to protect you from herpes virus or trichomonas or a yeast infection, or which isn't even a disease, it's just an fungal infection, or say chlamydia or gonorrhea. It's strictly for HIV.
But it
So
sounds like there's still a lot of STDs going around.
it's a lot
So
of STDs
I
going
guess safe
around.
sex would actually be something that you want to do or you want to have. You want to protect yourself and protect others around you. Have
Yeah,
sex with a condom.
and
Without a condom, and you don't have a condom, we don't have fun.
right,
That's the
right.
way that should go. So
Or
I'm
you
glad
have to
you
ask folks, what's your number? Have you been tested in the
right.
past, say, 30 days or 60 days? You know, and if they're not willing to tell you what their status are, maybe that's not someone you should be having sex with.
Oh, tell me, is there a difference now? I know it's rhetorical, but is there a difference between HIV and AIDS?
Well, it is a difference. Acquired immunodeficiency syndrome is almost like latent stage. HIV is human immunodeficiency virus. So you're testing positive. AIDS is all the symptomatic Kapoki spots, cancer, um, clot development. It's a syndrome. So it's HIV, it's acquired immune deficiency syndrome. So it's like a plethora of other symptoms caused by the HIV virus. So when your immune system starts to break down, your body's susceptible to infection. So it's the whole syndrome. So
Yeah,
HIV,
back in the day, a lot of guys were when they contracted it or when they were about ready to transition, a lot of them contracted ammonia.
pneumonia,
Pneumonia.
that's the
A
main
a
one.
lot of
Yes,
them had pneumonia.
pneumonia.
That was like one of the big things. If a guy had pneumonia, you knew something was wrong.
Pneumonia, TB, tuberculosis. They're susceptible to all these things because the immune system has broken down. The virus has taken over. So, yes, they're going to, and they would have it all. They would have TB, they would have pneumonia, they would have certain types of cancers, and different spottings, and their skin would change. They would have like excessive weight loss and thinning, loss of fat tissue, almost what we call in medical terms being cachectic, where
Mm.
you're almost just skeleton like. So it's the whole syndrome. It's latent HIV positive with all the breakdown of your immune system. So yeah,
Along with the mental health, a lot of people they get the what is it, dementia. Where
dementia.
they, yeah, with my brother, I'm going back to him again. When I was getting ready to move out here to Pennsylvania, he would tell people that I was his father and that he was moving out here to live here,
Okay.
even though he was already in hospice. So the mind, you start to lose your mind as well.
Now, was
That
he
starts.
older or younger brother?
Yeah, let me see. Well, I mean, he was in his 30s.
No,
So,
no. Was he older than you
oh no,
or
no,
your
he's younger
younger
than me.
brother? Okay,
Yeah,
your
yeah,
younger
yeah,
brother. Okay.
yeah. He's 2 years. He was 2 years younger than I.
Wow. Okay.
So, I mean, we were very close. You know,
Hmm.
that was my brother, and we went through the ups and downs, the trials, the tribulation, the people with the hatred. You
Right.
know, that hated my brother didn't even know him. They just hated him because he was gay. And like I used
Right.
to tell people, you know what? If you don't like gay people, why don't you stay away from them? Just
Exactly. It's
don't
that
bother with them.
simple.
You know, go do you. You don't have to be gay. You don't have to associate yourself with them. You don't have to bother with them. None of that. You know,
Yeah. The
they're not looking
stigma.
for you unless you're down with the crew. They're not looking for you.
Exactly.
So, you know, It's a lot of stereotypes and misnomers that you see that pop up all over the place, especially when it comes to AIDS. That's why I'm glad that you came on today, especially today, and your topic was about AIDS, because people do need to be educated, especially when it comes to STDs. I'm going to say it again. When it comes to STDs, people need to be aware, because apparently they're not teaching it in schools.
I listen, as far that health, it's everything's so politicized anymore. They don't want certain things being taught in schools. There's families and groups that are created from educating students about health and wellness, because they don't want to expose their children to these topics. But you should homeschool your children then. Education is knowledge. And just because you're educating someone on information doesn't mean that your child is going to go out and do something. It's knowledge, it's information. So you still have a choice at the end of the day. You have a choice.
To break it down pretty much like this. I don't mean to cut you off, baby, but to break it down is pretty much goes like this. You can't turn somebody gay. Exactly. You can't make somebody become gay. From what I've learned, hey, we go back to my brother. When he was 5 years old, everybody knew he was going to be gay. Right. So it's something that's within you. It's the same like trying to tell somebody that's heterosexual, you're going to be gay. You take a gay guy, you're going to be straight. That's ridiculous.
You're going to be straight. And that's linked through the Human Genome Project. A lot of people, and once again, this is information that a lot of communities don't want to hear. Through the Human Genome Project that was established in the early, I would say, 90s, they found genetic strands that if during pregnancy, the mother in that first trimester dealt with any tragedy, harm, death, emotional imbalance, violence, any kind of trauma within that first trimester when the brain is being wired, it can be rewired. And that's what they found. That was science and research. So like you said, when you have this 4 or 5 year old that had and they say it could be a female fetus and the brain is being rewired as a male. They found that in the early 90s. So I believe what you say when you can tell and look at a child at 5, 6, 7 years old that they might have feminine tendencies or attributes to them and be biologically male. It's true. I've seen it. I've seen that when we were in grade school. We would first, second, third, fourth
you know what they call them? You know what they call them? They call them sissies.
Call them sissies, yeah. Or they were just different, and you'd be like, oh yeah, And is that a choice? No. That's who they are, and that's how they manifest themselves. But as a whole society, they've come around a lot more to gays and homosexuals, but back then, it was taboo. You couldn't talk about it. It was like, it was like a bad thing. But that research-wise, that was found through DNA. So people that still decades later believe, oh, if you sit with a gay person or hang out with a gay person, you're going to be gay. That's just preposterous. It's ridiculous.
You know what that reminds me of? So when you check out history, you go throughout history, some particular people that didn't look like us, if they rubbed up against us, they didn't want to catch the black disease.
Oh God. But they stay in tanning salons. they thought what? The black was gonna rub off?
No, they thought they were going to get I'm going to say it straight out. They thought they were going to get the nigger disease.
Oh, God.
pardon my French because I truly do not like to use that word. I can't stand to hear it. But that's what they thought. They thought that they would get sick or they would die. That's why they had different bathrooms. It
Yeah.
wasn't just because you were black. I'm not going to use that bathroom. No way. Same thing they do with people that are gay. I don't know all the alphabet letters, but the people that are gay. I hope you understand what I mean.
Right.
And when they want to, my thing is, so you go to the bathroom, you're going to do one or two things. There's not a third thing that you're going to do. So I don't understand, why do you need an additional bathroom? I've gone places in my home. I use the same bathroom as my wife.
Well, a lot of that was to ostracize Black people as well, ostracize the Black community, to make us feel, to be indifferent towards us and make us feel like we didn't belong. That's that. A lot of that was power and control scams to, just basically make us feel like we're different. Yeah, we are different.
Dehumanize, and that seems to be going
on
today.
Dehumanize us as well.
Right, that's exactly what seems to be going on today with the LGBT. Okay, you know what I'm saying.
LGBTQIA. Okay. I know it used to just be LGBT, and then
it used to just be gay.
More letters got added on to it, but
it used to just be gay. That's pretty much what it was. That's pretty much what, male or female. What do they call females? The horrible word, they call them butches. And then the guys, they would call them faggots. So at one point it was just you were gay. There was no other.
Yeah.
If a man has sex with a man, then you're gay.
But I don't think that's what they call themselves, though, Kendall. I think that's what other people call them. Because that's why they came up with all these letters, because I think it's lesbian, transgender, gay,
bisexual,
queer, it's all these different.
All the same thing that rolls into you're gay. I'm sorry, I mean, that's kind of that's the way it breaks down to me. Now, you got to remember something. You're talking to a guy that's maturing. So back in the day when I was growing up, that's pretty much all it was. And nobody really cared. It wasn't so politicized as it is now.
Yeah, so. It's sad because we've come so far as science and technology, and sadly our community is still being affected at a higher rate than other communities. And I would just hope that with education and knowledge and better respect for yourself and better health practices, that those numbers wouldn't exist, and especially not be so high in these young people. These talking 13, 14, and 15-year-olds that are HIV positive. That's like, really? It's 2026. The AIDS epidemic was in the 80s. How are 13-year-olds being, they're having,
because they're not educated. I don't understand the society. This is a crazy society. I guess they feel if you don't tell them about it, it'll never happen.
Well,
it didn't happen.
People want to have blinders on. They want to live in their little silo and pretend a lot of things don't affect them.
All right. All right, Nurse Connie. Your time is just about end. So I'm going to go ahead and let you have the last word. And again, you can thank Mr. the Nurse Johnson.
Nurse Jonathan. Yes, thank you so much for your insight and sharing your experience and background with us regarding PrEP and HIV, and educating the community on statistics and what we need to do better in our community. It's just an eye-opener. We have to pay attention. We have to stay knowledgeable and get tested. Know your numbers. Don't have unprotected sex with someone you do not know. Please be safe. All right. That ends Wellness Wednesdays with Miss Connie. Yes. Bye.